250,000 new invasive breast cancer cases are diagnosed every year, but a 15-minute screening can detect cancer or just alert doctors that something suspicious and needs a closer look.
Mammograms are recommended for women at the age of 40, but some will wait or even skip the screening out of fear. Well, during this Breast Cancer Awareness Month, one of our own just turned 40 herself. Happy birthday, Melanie. And she went to get her very first mammogram, Melanie Lawson. She walks us through her procedure, hoping to take away some of that fear and inspire others to be screened.
My mom was diagnosed with breast cancer in her 70s, which is really a blessing because it was stage 0. She did tamoxifen for 5 years and she's still on it and she's doing well. So I did tell my mom I was doing this today, and I told her I was nervous, and she was like, Melanie, you just do it and everything's going to be fine. And if it's not, that's a blessing in itself because then you'll know. So that's what got me here. And here's how it all started.
I have some distractions.
The camera was a distraction for what I was about to do. I was more nervous about the unknown and that doctors would be able to tell me if there was something suspicious in just a matter of minutes. At Baptist MD Anderson, the process starts with answering some questions.
Okay. Thank you.
Those questions were asked to get more than just my medical history. For me, they revealed a hidden breast cancer risk that I would learn later.
Hi.
So we're undressing from waist up, okay?
Okay. But now it's time to prep for the mammogram. I undress from waist up, answer a few more questions from the mammography tech, and she explains what's next.
So you're going to stand here. I'm going to position you. As I'm positioning you, this paddle will come down and compress on you. I'm not trying to hurt you, but the better compression we get, the less radiation to your breast, and the better we can see through your breast tissue.
This is what I heard was the uncomfortable part. What some women have said is downright painful. 4 different pictures of my breast.
Okay, I want you to try to relax that shoulder.
It was faster than I envisioned. I was less exposed, mostly covered except for the breast being imaged.
That's it.
That's it?
Yeah, yeah.
That wasn't bad at all.
So,
and even though I'd seen a mammogram performed before, I really was shocked by how easy it really is. But it just really feels like someone's pulling at your skin and not really so much pushing down on your breast. So it was quick, it was easy. But I think, you're still a little nervous because you don't know what the results are going to be. Then, again, the unknown.
Do you see anything?
no, I'm fixing something.
Oh, okay.
She says this happens a lot. Patients want to know right away if she sees something, but it's the radiologist who interprets the film, and you have to wait. But not for long. I'll get dressed and get my results right away.
Hi, good afternoon. Hi.
Radiologist Dr. Mary Alderman will read the film. She's kind, passionate about the screening process, and explains the results in simple terms.
Well, the first thing I have to tell you is the good news that your mammogram looks beautiful. It's absolutely normal. So, yay, good news.
Dr. Alderman explains why this first mammogram is so important.
I think it's very accurate, especially when you have prior films for comparison. That allows greater sensitivity to be able to tell that everything is the same, not just everyone's a little different, like your fingerprints, but when we see what's normal for you and the next year it hasn't changed.
It's building a history that she'll compare from year to year. If there are changes, she can react. Also, remember those questions I answered when I first arrived? Those are part of the story too. All that information is put into a software program to get my risk for developing breast cancer in the future.
And your score was 31%. So that would suggest that there's something in there that's elevating your risk above the general population. That doesn't mean that we want to panic, but it means we want to pay attention to that and maybe investigate it further.
And I will, but now I know. And like my mom said, knowing is a blessing.
I do want to point out that for that initial screening, you normally don't meet with the radiologist unless there's a follow-up necessary. So I did, for the purpose of that story, really to just show you the entire process. Dr. Alderman did say that patients typically get your results in just a couple of days. If those results are normal, you'll get it in the mail. If there's any concern, they'll give you a phone call and then you come in for that follow-up. So it was a little scary, but it was good news.
Really encouraging for women out there, Melanie. And did they explain to you why your risk is high, though?
So this is so interesting. I mean, you answer 10 questions, benign questions, like when did you have your first baby? Are you African American? And a couple of the questions made sense, like anybody in your family has had breast cancer. And all of those questions together give them your risk rate. And so it's not necessarily one thing, because even my mom, postmenopausal, having breast cancer, shouldn't have set me that high.
Right.
So now, there'll be a follow-up to see if those numbers are really accurate.
So speaking of that follow-up, what's recommended for you?
So for anyone who has a risk above 20, there's the concern. You meet with a genetics counselor, and they'll kind of play with those numbers and make sure that you gave accurate information. And then from there, if I decide to go in a high-risk group, I would get an MRI every year along with the mammogram. So 6 months I get an MRI. At the year I'd get the mammogram, and then that would continue, at least for right now, for the rest of my life.
It is so wonderful that you did that
Thank
for everyone.
you.
That's really personal.
It is so
You know?
personal.
I mean, that's...
And luckily I had a female photographer.
Yeah.
I will say that.
And
that
happy
definitely helped.
birthday.
Thank
Just
you.
like Joyce said.
Thank you. Not the ideal present,
Welcome
but it was
to the group.
okay.
Welcome
I
to the
know.
club.
All right. If I look like you ladies, I'm good. Thank you.
Thanks, Mel.
All right, so real quick, coming up tomorrow on the morning show during the 8 o'clock hour, we're going to talk with a medical oncologist from MD Anderson about preventing breast cancer, the habits that will reduce your risk, and also the newer technology to help detect breast cancer. Again, that is tomorrow morning during the 8 o'clock hour.